I remember at one point looking at Dr. Miss Standria, and we both just had this look of dread on our face. Here was this young woman with this devastating stroke in the basilar artery of her brain. I didn't think she was ever going to speak, walk, or have any type of purposeful life.
I grabbed a lunch and brought it back to my desk. And the last thing that I remember is I was very lethargic and I felt like I couldn't move. You know, I felt like I needed to take a nap. I couldn't speak. I couldn't call out to my colleague. Physically, I was unable to move. I was only concentrating on the left side of my body because that's the side that wasn't working. So my colleague thought she heard me crying. So she came around to my side of the office and found me on the floor, and she knew that I was having seizures. So she right away called 911 and then called security at Vassar College.
When we first saw Jodi in the emergency department, she was not responsive. So we activated a code stroke.
We knew we needed a CAT scan. We needed to know exactly what was going on. We got a CAT scan of her head and came back to the room where Jodi was having seizures.
But unfortunately, this wasn't a typical seizure. This was a seizure that wouldn't stop. By protocol, we also did a CT angiogram of the head and neck, and that's where they found a basilar artery occlusion.
I first met Jodi when she was in this room on this actual operating room table behind me. Her case was unusual in that most patients who have strokes don't have what's called posterior fossa problem, or a problem with the base of the brain. Seizures are usually something in the top of the brain or the supratentorial compartment. A basilar artery occlusion is a very rare and life-threatening disease. It is approximately 4% or less of all strokes, and there are approximately 4 people per 100,000 that would have a basilar artery stroke per year, and overall has a very poor prognosis and is extraordinarily deadly. Mechanical thrombectomy is a surgical procedure where, in her case, we worked through the blood vessels of the arm and brought catheters and wires into the vertebral artery and eventually into the basilar artery to remove the blood clot or blockage, restoring blood flow.
The day that my mom had her stroke, I was actually living and working in Boston as a teacher. All of a sudden my phone started ringing and my aunt called me and I was like, oh, she's just looking for my cousin. Like, I'm not worried about that. And so I texted her back and I was just like, I'm at work, like, can I call you later? And she was like, no, I need you to call me back now. And I was like, what? Like, that was weird, that was strange. I basically grabbed my stuff and walked out. Second I got here, she'd gotten out of surgery.
I don't remember anything for a little while, and then all of a sudden I can remember that my daughter was there, my sister was there, I had some visitors, speech therapists came in. I didn't realize that it was as catastrophic as it was. I went from being this very independent woman in her mid-50s to very dependent on people, on my daughter, on family members to drive me to appointments.
When Jodi first presented to the outpatient department and we assessed her communication, she presented with a mild impairment in her speech production called dysarthria. She also had at least mild cognitive impairments in the areas of attention, delayed memory, and language for word finding.
Her primary deficits in occupational therapy were fine motor coordination and grip strength, left upper extremity strength, inhibiting her ability to perform daily tasks such as driving, getting dressed, brushing her teeth.
In terms of physical therapy, Jodi's biggest deficits were definitely balance, and she had some coordination issues which were really affecting her ability to walk. She could walk very short distances. She was using a cane sometimes. She would have to grab onto things. She was really dependent on her daughter. She was also experiencing a significant amount of pain, so she was having a lot of difficulties getting around. She was unable to work, unable to walk her dog, Giovanni.
By the time she was ready for discharge, her speech clarity was back to her baseline. It was just really beautiful to see, and she's just somebody who was a joy to work with, and it felt really good to see her wonderful outcome.
In the last couple of months, I somehow started getting my motivation back. I finally just got up and started moving and exercising and walking my dog.
I think like when she started walking the dog was definitely something that I was like, yes, because that was a big thing. It's just very encouraging to know that there's more for her and for our family, like in the future in general, and just things will be good.
Jodi is such a miracle because she came in extraordinarily sick. Thankfully, Jodi had an amazing outcome and she has almost no residual effects from her stroke.
The doctors and the care team, in general, everyone just kept telling me, you're a miracle, you're a miracle. And I did finally say to myself, I think the more I educated myself, I realized, wow, I really am a miracle. I really, truly, from the bottom of my heart, thank the care team for their exceptional work. I thank the American Heart Association for involving me. It's great appreciation, makes me really feel that I'm giving back to the community.